Welcome back to Shark Tank. I hope you guys have been just wowed by all of the innovations that you've seen so far, and there are more to come. So we are going to continue with Shark Tank. We have our first live presentation, which is going to be really exciting. Marguerite Wevers is going from Children's National Hospital is going to talk about innovations in transition for children with CHD, and I will let her share her screen now.
All right. Hello, everybody. So like Jody said, my name is Marguerite Wevers. I'm a registered nurse working in the Washington Adult Congenital Heart Program, and that's at Children's National Hospital in Washington, D.C. And I'm going to be speaking with you about the telemedicine transition program that we've developed, which is an innovative model of care that we use to help patients transition from their pediatric care to their adult congenital heart care. So just to share, I have no financial disclosures to share at this time. So first of all, a little bit about us and what an ACHD program is. So that's an adult congenital heart disease program. And what we do is we care for patients with congenital heart defects when they grow into adulthood. And so they see a pediatric cardiologist frequently when they're a child and as they're growing up, but eventually as they grow older, they start to have more complex needs and they start to need to see a doctor who specializes in what congenital heart defect patients see as in the rest of their lives. So we work out of a pediatric hospital, but we actually only see adult patients in this hospital. And so our patients are sometimes non-local, sometimes they come from other areas because this is Washington, D.C., so we've got a lot of adults here who come from other areas, and sometimes they'll see us while we're here, while they're in the city. And then a lot of times they're just patients from the area who have grown up. We care for patients that come from far and wide. Some of them are in Maryland, some of them are in Virginia. We've got some in West Virginia as well. And when those patients grow older, they frequently get referred to our program. Sometimes they're even referred to our program from the pediatric cardiologists at our own hospital, actually. We'll also sometimes get some referrals from non-congenital providers. So what will happen sometimes is a patient will start to see an adult cardiologist, and that's someone who specializes in acquired heart disease. And the adult cardiologist will do some testing and will realize that the best place for them to be seen is by a specialist who understands congenital heart defects. So sometimes that's how patients find their way to us. And what's important, and that's what we're seeing, is that in research studies, we're noting that there's a high rate of loss to follow-up. So what that means is that the patient stops making follow-up appointments, doesn't see their cardiologist regularly. And unfortunately, what can happen when they're not seeing their cardiologist regularly is they don't recognize signs and symptoms of cardiac problems, and that can sometimes lead to worse outcomes for those patients throughout their lives. So I just want to show you, this is the findings of a study that was done by the Montreal group, and this is about loss to follow-up and congenital heart defect. So this green part right here is attrition. So that means the loss to follow-up, the patients who don't come back to us. And the blue squares here are the ones who do continue to be seen. So you can see that patients who are under 6 and who are usually at that point diagnosed by a cardiologist are seen. And then as you start to get older and older and older, there's fewer and fewer patients that are being actively seen by a cardiologist. And the worst that we see here is from ages 18 to 22, only 39% of patients are being seen by cardiologists. So that means that 60% of congenital heart defect patients from ages 18 to 22 are not getting the necessary cardiology follow-up that they need to stay in good health. So that was what led us to think about how we could help improve those numbers. So our telemedicine transition program, what we noticed initially when we were trying to help patients transition into our program was that we were trying to meet with them at their visits and at their in-person visits with their pediatric cardiologist. And what we noticed is that because of the time limitations of those appointments and because the patient is going through a lot of learning and sometimes some emotional stress as they're getting their testing and hearing their results from their cardiologist, that's not really the best time for them to discuss how they can successfully transition to adult care. So we decided to design another program. And the goals of this program were to empower patients and families to be active in their care and to prepare them for the lifelong care that they're going to have for the rest of their lives. So the features of the program are remote appointments that are done through Zoom. So what we notice with this is that this kind of has two different perks. One is that now in the COVID-19 world, this helps reduce risk. And also the original reason that we thought to do it is that this is meeting patients where they are and on their schedule at home. So that's a little bit easier for them, and that sets up a better setting for learning for the patient in a more relaxed setting. If they get to do it from home, they get to have whoever they want there, and they don't have to make what can sometimes be a really long, really stressful drive into the city. The program is individually tailored to patients. So what that means is that what the patient learns is based on their wishes and their needs. Also incorporate where the patient is at in terms of their development. So we make the goals appropriate to the age of the patient as well as their own developmental level. It's a multidisciplinary program, so it's carried out by social workers. We have a research coordinator who also works on it, and we also have nurses who meet with the patients. And it's really focused on the patient and the family learning and doing skill building. So this isn't a medical appointment. This is an appointment geared towards education. So the components of the program is that it starts off for everybody with a social worker assessment that takes place with the patients and with the parents after the patient's been referred to us. So during that assessment, that gives the social worker and the family the opportunity to talk about and modulate those goals for the right level for that patient. We'll talk about that a little bit more afterwards. But once they've picked their goals, there's three sort of buckets that those goals can fall into. One of them is care coordination. So those are the skills to navigate the medical system. One of them is medical knowledge, understanding what their congenital heart defect was, understanding what surgeries they may have had, understanding what medications they're on. And another big one is mental health resources, which as patients get older and older, they need to be able to also take care of themselves emotionally. And we have seen in research that CHD patients have increased rates of mental health conditions. And so we want to make sure that we're helping them identify those issues early and that they have the resources they need to be able to take care of themselves completely. So the different topics that we can cover under those kind of three different buckets. One of them is managing medications. And so an example of how we might modulate that to the patient's age and developmental level would be that if it's a 12-year-old patient, we may have the goal of teaching them what are the names of their medications, and that might be sufficient for them. Now, a 15-year-old might benefit more from what are my medications and what do they do? Why do I take them? How do I benefit from taking them? And then for an 18-year-old, that might look like teaching them to take their medication regularly and independently without prompting from their caregiver. We can also teach them understanding their cardiac diagnosis, symptoms of poor heart function, understanding health insurance. That's one that's complicated for people with or without congenital heart defects, but it's very key and very important for them to maintain that. Coping with stress, managing a portable medical summary, which is a place where the patient keeps all of their medical information, their doctors, and their conditions straight that they can refer to. Healthy lifestyle, and self-advocacy, so being able to stand up for themselves and ask for what they need in their care. So this is where I get a little bit more into what the actual steps of the program are. The initial assessment is the piece that I mentioned where they're meeting with a social worker. These patients can range anywhere from 12 to 22 years, and they've been usually referred by their pediatric provider who said, hey, this patient meets your criteria. Would you be willing to teach with them? So they meet with the social worker, and during that meeting, they do some goal setting. Now, the goals, there's a number of goals that they can pick from, and the patient or family gets to pick one of the goals based off of what they think they need. And then one goal is selected by the transition team based off of that discussion as well as to how we think we can help them. During the action plan phase, they have telemedicine meetings with either a social worker or a registered nurse or both, depending on what goals they selected. And those telemedicine meetings, again, take place over Zoom and at the patient's schedule. And they do that throughout the year to get ready for a reevaluation that happens at the end of the year, where they meet with the social worker again and they discuss kind of what they've learned, what their successes have been, and what kind of roadblocks they've run into so that we can understand what we're teaching and how we're helping them. They also get the option at that point to re-enroll if they decide they enrolled perhaps at the age of 14 and at 15 they decide they still think they could learn more, then they have the option to re-enroll with us. So what we're hoping to achieve here is three really big things. One of them is for more patients to follow up with their cardiologists and transition into adult congenital heart care, because we believe that that will lead to better outcomes for those patients. And Also increasing patient learning and empowerment. So teaching patients how to take better care of themselves because they understand their condition, their needs, and what they need to do better. We really want patients to be able to understand more about their congenital heart defects and to stand up for themselves and their needs and to feel comfortable discussing their care. So that means that they should understand why their doctor is giving them instructions, how to talk to their doctor, and how to talk to their doctor about what their plans are so that they can really be a partner with their doctor in their own care. We also want to use the study findings to help improve education for ACHD patients all over the country. So this is a IRB approved research study that we're doing. And if we find that this teaching program is an effective way for people to learn, we're hoping to be able to disseminate those findings so that other programs can try and increase the amount of patients that are coming back into their care and also have some more empowered and better educated patients in the future. So we are really, really excited about this as a group. We've been working on getting it off the ground and we're starting to see our patients for it. And we are really hoping that we can create some more empowerment for our patients through it. And then this is just a little photo of our program group at Children's National. We have a really multidisciplinary team. We've got 3 different physicians. We have 1 surgeon who works with us and does surgery. We have 2 nurse practitioners, 2 nurse coordinators, a clinical research coordinator, a social worker, and finally, but last but absolutely not least, we've got a program coordinator who keeps us all together. So we're a pretty big, diverse group of folks, but we've all been brought together by caring for our adult congenital heart patients and trying to make a change in their outcomes. That's that.
Okay, that was so excellent. It's just such an exciting program. I know there will be questions for Marguerite. Andrea, what questions do you have?
So the first question I have comes from Facebook, and it is, what is the biggest challenge for patients transitioning to adult care?
Was the question, what is the biggest challenge for patients transitioning to adult care?
Yes.
I think we're hoping to have some scientific evidence on what those barriers are, but I think some of the perception has been that it's a little bit difficult because their care can be so complex. It can be difficult for patients to move from having their caregiver help them with their care to independently taking care of themselves. Sometimes parents have been really in charge of advocating for their children for a really long time, and they're really good at that. And what we want is for our patients to be able to build those skills for themselves and be able to do that for themselves as well.
Great. Okay, if anybody has any other questions, please type them now. Okay, I don't see any more questions. Thank you so much.
All right. Thank you so much for the opportunity to share with you guys.
Thank you for being on here. And I know people, you can type your questions in the comments as well, and Andrea can read them from there. But thank you so much. And thank you for, again, for all you all at Children's National Hospital. This is such amazing work, and we're so excited to see this for our patients and families. As a person with a 17-year-old, I know how much this is needed, and I'm just really excited to see what you guys are doing.
Thank you so much.
Thank you.